Okay, so welcome back. Now this is a case of nystagmus. So what is nystagmus? So nystagmus is an involuntary, rapid and repetitive movement of the eyes. That is the eye twitching. So you can see that there is twitching of the eyeballs. So nystagmus can either be in a horizontal direction, that is in side to side, that is called as the horizontal nystagmus. Then there can either be in a up and down condition, like up and down movement, that is the vertical nystagmus, and also there can be in a rotary direction, that is the rotary nystagmus, that is the circular direction. Okay, so why nystagmus occurs? This is the main question, that why it occurs. So nystagmus occurs when the part of the brain or inner ear that regulates eye movement and positioning doesn't function properly. That means that the brain stem, either in the pons, medulla or the midbrain, or there is any pathology in the inner ear. That means that the semicircular canals, if there is any pathology or the otolith gets dislodged, then this causes nystagmus. So we can see here in this diagram, we can see the semicircular canal, we can see the horizontal canal. If suppose there is any pathology in the semicircular canal, or there is any pathology in the midbrain, pons or medulla, so this leads to nystagmus. So in normal condition, in normal physiological conditions, when we see that whenever we move our head, we move our body, the labyrinth here, there is a, this maintains a balance. So there is a correction of the brain stem, which is the slow phase and the fast phase. This basically corrects. So the nystagmus involving the vestibular system in the inner ear or the brain, the patients experience vertigo, dizziness or loss of balance. So there can be uncontrollable eye movement, nighttime vision problems, shaky or blurry vision, balancing problems, then light sensitivity, and also dizziness. Dizziness means commonly this presents as vertigo. Okay, so the patient complains of vertigo, he is having some saying that he is experiencing dizziness or vertigo. So now we'll be discussing that this semicircular canal, we know that there are three semicircular canals, right? So one is the anterior, one is the posterior, and one is the horizontal. Okay, so if suppose the left horizontal canal is affected, so the type of nystagmus which will be seen will be a horizontal nystagmus. So you can see here in this video there will be a horizontal nystagmus. If suppose the left posterior canal, if that is affected, then that will be up and down, like the eyeball movements will be up and down, that will be a vertical nystagmus. Okay, and if suppose like the left anterior canal, if that is affected, if suppose there is any otolith which is dislodged there, then there will be a circular and downwards movements. Okay, so these kind of nystagmus will be seen. So till now we have discussed about the pathologic nystagmus. Now we'll be discussing about the physiological nystagmus. So optokinetic nystagmus, this is a physiological phenomena. You people will experience this. Like suppose the example is whenever you are traveling, you are looking out of a window when traveling in a train, there will be twitching of the eyeballs. You know, there will be a horizontal twitching of the eyeballs, that is optokinetic nystagmus, that is physiological phenomena. Okay, thanks for watching guys.